Hey everyone, we have Dr. Jared Wody, who is an ER physician. He had his procedure with us yesterday. Planned initially 2,800 grafts. We ended up doing 3,100 grafts to address couple areas of thinning hair in the front and the crown area. Dr. Wody was kind enough to agree to share his experience. You just had your procedure literally yesterday.
Yeah.
What are you doing here today, this morning?
So this morning, starting off with the day with additional hyperbaric therapy, just to improve healing. It's really beneficial in the process. And then getting a bandage change, checking on things, and everybody's making sure I know what to do post-op. There's no confusion there. It's reiterated plenty of times so that you can understand what you need to know, so that you have the best outcome that you can ultimately achieve. Which is amazing. So it's right after surgery, they even play a video in the hyperbaric chamber because it's, reading a bunch of paper. They still send the paper home with you, but having the video to go over everything too, it's just really helpful to reinforce the things that you need to do to have the best outcome.
Perfect. So could you elaborate a little bit about, your selection process, because you've been looking for getting the procedure, right?
Yeah,
for some time.
Yeah.
What made you actually think about hair restoration in general?
So initially, when I was in medical school, it's actually the first time I noticed the thinning on my crown. Somebody pointed it out to me before, then I had no clue. And, I put it off for a while, and then I decided to try Rogaine and finasteride and got what I could out of that. And that's the time when I started researching hair transplants, but I also wanted to make sure that because it's still a continuing process, that I could tolerate the medical therapy so that I wouldn't have any side effects from it, so that it would make my transplants more long-lasting.
Right.
So that was really my first step. And then once it came time to look for a surgeon, I looked around. Everybody talks about Turkey, and just being a physician, I know even not just hair transplant surgeries, there are many other surgeries that people shop abroad for. And I'm sure there are some good clinics there, but there's not as strictly regulated procedures and how to go about opening those clinics. And the risk of having a bad outcome is much higher. And having somebody who really maybe only cares about the money and not so much the actual aesthetic outcome that you're going to achieve for the patient. So I never really considered international for that reason. And then looking locally here in Florida, I went to another consult that really, again, felt more like a sales pitch to me. I never met with a surgeon the entire consult. It was just a sales rep that just kind of reiterated kind of buzzwords and things to get you excited about transplant surgery, but didn't really, I felt like, and not just because I'm a physician, but I just did my research ahead of time, but I felt like I knew maybe even a little more than what they were explaining to me, but they were trying to sell me on all these therapy packages to sign up for, with if you sign up now, you get this discount, but don't think too long. So I really didn't like that.
So more like a car sales tactics,
That's
right?
How it felt.
Yes.
Yep.
And you see, what makes you different as a customer, and I really appreciate it, because that's why I try people to actually come see the clinic, talk to me, because as a physician, you understand what is standard of care.
Right.
Okay. Right. And unfortunately, a lot of our customers, there is a big bombardment with Instagram, social media, and there's almost a drive-through mentality that being created by this social media, that people start thinking, oh, it's not a big deal. You just go somewhere, go abroad, they just pluck some hair, they put it somewhere else, yep. And that's it, because this is social media. That's what they want you to believe. But as a physician, you understand there's a lot of very specific details. Hair restoration takes years of expertise. So experience as a physician, what do you think, how the entire process went with the surgery?
Excellent, very professional, lots of preoperative communication. The initial consult, they had multiple iterations to explain everything and in different ways. and multiple opportunities to ask further questions to be answered. And then from there, coming in for the actual procedure itself, everything was really smooth. The entire focus is on you that day. So Dr. Max, the whole team, everybody is focused on you the whole time. So you feel well taken care of. There was never a moment where I felt like things were going awry or any time where I was uncomfortable. It was pretty smooth the whole time, and I have virtually no pain afterwards as well. Mild soreness, that's it.
Yes, and people frequently ask, so my patients, they do have some blood appearance in the top, and there is a reason why, and as a physician you probably understand. So when you look at these Instagram pictures, videos, when patients being poked with a needle and there's zero bleeding, why do you think it happens?
I imagine they're probably putting epinephrine in there.
Exactly. So this is how a physician thinks. So this is exactly why I don't want to use epinephrine, because epinephrine will vasoconstrict the area, will deprive the area from oxygen, and consequently hurt your grafts. When you do the implantation, you want to provide as much oxygen as possible. That's the reason we use the hyperbaric oxygen therapy, to actually do the opposite, right? Then the vasoconstriction. So I don't use epinephrine. So my surgeries, they look, more bloodier, but there's no bleeding actively the next day. And do you agree that's probably the right approach?
Makes sense.
Yes.
Yeah.
Yes. About the entire process of the procedure, right? So you've noticed that, I've been with you every single minute, and what I think it's important for my patients, and I felt before with the standard approach when physician either just harvesting or not harvesting or not implanting, but delegating to technicians, you create a distrust for patients, okay? Because you're relying on somebody else's skills that could be questionable for your outcome. So I decided it's not going to be the approach in my place, so I do the entire procedure with my own hands from beginning till the end, and my assistants doing what they're supposed to. They assisting me. But by the way, you're able to observe on the big screen TV the entire implantation process, right?
Yeah, it was really neat. It was really cool to see, just to see exactly how it was done and what areas we're working on, and seeing the density difference. Well, we discussed it earlier in the consultation as well.
Yes, exactly.
Nice.
But so we have so I use in my practice a large microsurgical microscope, not the loops, so I'm able to work more comfortably instead of having some heavy optic on my head that will ultimately lead to some neck pain. And if I'm not comfortable, obviously the quality of the surgery will suffer. So everything was created to be more ergonomic. Microsurgical microscope with a camera installed. We are fully transparent. So when I say it's 3,100 grafts, it is 3,100 grafts, and my patients can actually observe every single graft with their own eyes. And same thing happens. We did partially robotic harvesting, and then manual harvesting from the back of the head. And same thing with graft counts. We have cameras in the microscope, and I'm able to control every aspect of the surgery as well, right? So, so overall, so far,
it's been great. It's a great experience. I'm very happy. Very happy. When I was searching, you were the only one that I could find that was going to be the surgeon that's in there doing the procedure the whole time.
Perfect.
So, and I'm very happy that I went with this decision.
Thank you so much.
Thank you again. I appreciate it.